Hello, welcome to my platform. I am Dr. Sandra and I am a surgeon. I hope you become aware and sensitized about the different surgical conditions. Today's video is about a carbuncle. A carbuncle is a pus-filled swelling that occurs when bacteria infects two or more hair follicles, and this can result into the death of the skin as well as the subcutaneous tissues, the tissues just below the skin. It is more like a furuncle, but the difference is in a furuncle you only have one hair follicle that gets infected, but in a carbuncle you have two or more hair follicles that get infected. And when it comes to the size, a furuncle is smaller than a carbuncle. A carbuncle is bigger in size. In majority of the cases, carbuncles are caused by a bacterium called Staphylococcus aureus. However, other bacteria have also been implicated. For example, the methicillin-resistant Staphylococcus aureus. What happens in a carbuncle is when the bacteria infects two or more hair follicles, there is a recruitment of the cells of the immune system. The immune system, by the way, is a system in your body that is responsible for fighting off any invading germs, for example, bacteria. Among the cells of the immune system that get recruited are the macrophages. The macrophages contain some structures within them called lysosomes. The lysosomes contain some enzymes within them, and once these enzymes are produced by the lysosomes of the macrophages, they tend to cause destruction of the tissues below the skin as well as the skin. And they do this by converting the tissues into liquid form, and this can result into pus formation. The blood vessels that supply oxygen and nutrients to the skin as well as the tissues below the skin can also get destroyed and blocked, and this can prevent oxygen and blood as well as nutrients from being transported to the tissues below the skin as well as the skin, and therefore the skin and the tissues below the skin can die off, and the skin can also turn black. The bacteria can also produce some poison called toxins, and this poison can also cause further destruction of the tissues below the skin as well as the skin. The sites of the body that are commonly affected by carbuncles include the back of the neck, the back, the shoulders, the cheeks, the hand and the forearm. The individuals that are commonly affected by carbuncles include the male gender, individuals that are 40 years and above, individuals that have obesity, individuals that have a poor hygiene, individuals that live in crowded environments, alcoholics, obese individuals, individuals that have had contact with individuals that have Staphylococcus aureus infection on their skin, individuals that have certain skin conditions, for example, eczema, psoriasis, as well as individuals that have a low immunity for some reason. Maybe they have HIV, they have diabetes mellitus, they are on steroids, or they are on anti-rejection drugs. Maybe they have undergone an organ transplantation. When it comes to the signs and symptoms of carbuncles, the first thing that happens is the affected area will become itchy, painful, swollen, reddened, and tender. That is when you touch the area, there will be some pain emanating from it. The next thing that will happen is there will be appearance of some swellings called vesicles. Vesicles, by the way, are just small swellings that contain clear fluid. With time, the vesicles, that is those small swellings that contain clear fluid, will be filled with pus, and the affected area will start discharging pus. The vesicles that are close to the center of the lesion will join and they will form a dark black ulcer. There's something I really want to emphasize about carbuncles. Just like the furuncles, please avoid squeezing the carbuncles. This is because the bacteria that cause carbuncles can spread very fast to the rest of the body. The complications that can arise from carbuncles include sepsis. Sepsis, by the way, is an exaggerated body's response to the presence of bacteria in the tissues as well as blood, and it can lead to the recruitment of the cells of the immune system, and the cells of the immune system can produce some chemicals called cytokines, and these chemicals can cause a widening of the arteries, and this can prevent blood, or it can reduce the amount of blood that goes to the organs of the body. And the organs of the body, for example, the heart, the kidneys, the brain can shut down and the patient can easily die. Another complication of carbuncles includes internal abscesses. Internal abscesses is when there is collection of pus in different organs of the body. For example, the kidneys, the lungs, the liver, the heart, the brain, and it is usually as a result of bacteria being transported into the blood vessels, and the bacteria can be transported by the blood vessels via blood, reaching those various organs. Carbuncles can also cause permanent scarring of the affected area. The investigations that we carry out in carbuncles includes a discharge study, where we take off a sample of the pus and we can carry out some tests. We can do a culture sensitivity, gram staining, Zn, PCR, ELISA, and this can help us identify the bacteria that is causing the carbuncle, such that we can tailor our medications to that bacterium. We also do some investigations that can rule out a possibility of any underlying conditions, for example, diabetes mellitus. So we have to do fasting blood sugar levels or random blood sugar levels. We can as well do a urine analysis, where we look out for glucose and ketones. When it comes to the treatment of carbuncles, we can employ antibiotics, and these are usually tailored by the culture and sensitivity results. We can also employ incision and drainage. Incision and drainage is a surgery where we make a small cut on the carbuncle and we can drain out the pus. We can also do debridement, where we cut away the dead tissues in the carbuncle as well as the dead skin. And if there was extensive tissue damage, we can do skin grafting after some time. We also do management of any underlying conditions, for example, diabetes mellitus, high blood sugar levels. When it comes to the prevention of carbuncles, please exercise good personal hygiene. This can be done by showering daily and regular washing of hands with soap and water. Please avoid sharing personal items, for example, clothes, washcloths, shavers, bed sheets, and towels. And for individuals that have carbuncles on their body, please make sure that you always wash your hands if you touch the carbuncle. This can prevent transmission of the bacteria to another individual. Please also wash towels, clothes, bed sheets that come in contact with the carbuncle. And for individuals that have any underlying conditions, for example, diabetes mellitus, low immunity, these have to be managed. That is what I had for you. Thank you so much for watching. Please share my videos and also subscribe. See you in my next video. Bye.